All right, hello everyone. Welcome back from your breakout rooms. We have three awesome guest speakers here today, and we're fortunate enough to have them present and also do a short Q&A towards the end. So real quickly, we're gonna go over what HAND is. I'm sure you guys already know, but HAND at UCLA stands for High Tech and Neurological Disorders, and we mainly work to increase awareness and education of neurological diseases, including movement disorders such as Parkinson's and essential tremors. And we are composed of a community of undergraduates interested in neuroscience and biotechnology. And we currently have 5 professional advisors, including the director of the Movement Disorders Clinic at UCLA. And for HAND, we have kind of 5 fronts that we're focusing on. First is education. An education committee, they host our seminars, our guest speakers, and mainly they also host a podcast, but they aim to just educate the whole club as well as their community. Outreach, they work on blogs, and they're planning on teaching middle school and high schoolers about neurotech and neuroscience. Public relations, maintain our Instagram page and help with our awareness social media campaigns. And fundraising, we recently did a fundraise opportunity. We basically donate money towards the Movement Disorders Clinic to help patients, as well as fund the program. And lastly, we have an innovation team, which is composed of around 16 students, and they work towards developing prototypes to aid patients with Parkinson's disorder. And yeah, that's that's who we are. And now we're gonna get started with our panel here. And first we have Dr. Dorothy Xiao. She's a retired pediatrician and neonatologist, if I'm pronouncing that correctly. Dr. Xiao attended the University of Maryland School of Medicine, and she did her residency in pediatrics and fellowship in neonatal perinatal medicine at the Children's National Medical Center at George W. University. And I'll let Dr. Xiao say some words.
Hi, everybody. Okay. All right, I'll just talk. I am retired, and I went to medical school many years ago. I practiced general pediatrics and for about 10 years, and then I did neonatology for about 30 years after that. So when I went to medical school, there were only 10 women in my class out of 100 students. It was only 10% women. At that time, I think there weren't any female urologists. It was a different time in medicine. At that time, women primarily went to 3 specialties: psychiatry, OB/GYN, and pediatrics. I chose pediatrics because I love children, and I love, and then subspecialized in neonatology because I liked the life, death, resuscitation issues of birth issues, of taking care of babies in the hospital. And I like the interaction with the another OB/GYN specialty, working with them so that we had the best outcomes for the babies. I was very fortunate to be training at a time when some of the survival of babies, premature babies, went from 90% at about 34 weeks to about, so that we were saving babies at 24 weeks gestation, which is about 6 months, I would say. That was a very exciting time for me. I really enjoyed it. The technology is great. We had a lot of issues with the developing newborn brain. That's a huge area of development, and the plasticity of the brain. And so another whole area, if you guys are interested in pediatric neurology at all. Anything else you want me to say?
Oh, that was really excellent. Thank you, Dr. Xiao. And I'm
Okay.
sure our members have sent in a lot of questions for you. So
Okay.
we'll have plenty to talk about later on.
Okay.
And introducing our second speaker.
Yeah, so our second speaker for today is Dr. Daniel Mcarthur, who is a vascular and interventional radiologist. He went to med school at the University of Maryland and did his residency at Tufts Medical Center in diagnostic radiology. His fellowship was in vascular and interventional radiology at the Beth Israel Deaconess Medical Center, which is a teaching hospital of Harvard Medical School. And he is currently, I think, with Guilford Radiology. So, Dr. MacArthur, if you have anything that you would like to add to that.
Hi, yes, thanks for having me. So I graduated medical school in 2010, 35 years after my mother. And then I did a residency in both radiology and interventional radiology. So that's a 6 years training program after medical school. And then now I've been practicing as a radiologist and interventional radiologist for about 5 years in Connecticut. So I do about half my time doing interventional procedures, which are basically image-guided procedures. So for example, today I did a breast biopsy looking for breast cancer. I biopsied a liver lesion that was suspicious for cancer. I placed a feeding tube into the stomach because the patient could not eat through the mouth. I did a couple consults regarding tumor ablation of a kidney cancer that basically I can treat by putting a small probe into it, and then it delivers a lot of heat energy into that probe to basically necrose the tumor. So it's an interesting field because there's a lot of different image-guided procedures and different ways of treating things non-surgically. The other half of my job is as a diagnostic radiologist, and that is where I look at X-rays, I look at CAT scans and MRIs, and try to figure out what's going on in those imaging studies. So I'll leave it at that and answer any questions later that may come up.
Awesome, thank you. Yeah, and Tiffany will be presenting our final speaker.
All right, and our third panelist for today is Dr. Kristen Mcarthur, who is a gastroenterologist. Dr. MacArthur attended the University of Connecticut School of Medicine, and she did her internal medicine residency at the Beth Israel Deaconess Medical Center and her gastroenterology fellowship at the Boston Medical Center. Dr. MacArthur, if you'd like to say a few words to our club here, that would be amazing.
Sure. Thanks so much for having me. So I graduated medical school a little over 10 years ago, and then I went to Boston to do all my training. I chose the field of internal medicine, I think, because it was a nice broad range of all different types of medical problems. Then after 3 years of residency as an internal medicine resident, I decided to pursue a fellowship in gastroenterology. So I did 3 more years of training. And then I joined a private practice in Guilford, Connecticut. So I spend my time, about half my time, I see patients in the office with general gastroenterology questions or concerns, things like constipation, diarrhea, abdominal pain. And then I spend the other half of my time doing procedures. So I do procedures such as colonoscopy, upper endoscopy, flexible sigmoidoscopy. I also put feeding tubes in the stomach. And then I spend some of my time also in the hospital seeing patients who are admitted with acute problems, more like, gastrointestinal bleeding, and work to stop those problems using procedures. I think I chose, it's hard. I think I chose the field of gastroenterology. I think a lot of people ask me that question, like, why would you have chosen this field? I think it is a great field in that, one, you really get to develop relationships with people over time, because a lot of patients have a lot of chronic problems that they come back to you. It's a very personal field, and so I think it's lacking in women in general. And so I'm still in the minority by being a woman gastroenterologist. So I feel like I'm filling some void there. And there's also the gratification of doing procedures where if someone's having a very acute problem like bleeding, you can solve that. So you kind of, in a way, can solve a problem very quickly. It can be very satisfying to help someone in that way. So I think I'll leave it there, and I'm happy to answer any questions as well.
Awesome, thank you so much. Well, this is perfect timing. We're gonna move on to our Q&A session, and a lot of our members have sent in questions already, so I'll get right to them. I'll stop sharing. Okay, let me pull up the questions. And RT and I will be moderating the discussion, so if anyone has any additional questions, you guys can put them in the chat box. Okay, so this first question comes from, anonymous, but it asks, for all the guest speakers, what have you found to be the most rewarding experience in your career field?
I think the most rewarding thing was the relationships that I had with the parents and the patients, and the ability to take parents through very tough decisions to very joyous situations when babies were survived and did well. We would have parties for preemies every year, the graduates, and to see them develop and grow was really, really rewarding. On the other hand, we had babies born with severe congenital defects, some that were not compatible with life, and helping parents work through that was extremely rewarding for me. There was a lot of ventilators and all that kind of stuff that was good, but the most rewarding thing for me was working with the patients, and that's what I remember the best.
You want to go ahead?
Sure, I'd like to echo that. I think the relationships that you get as a physician with your patients is really special, and especially when someone comes back over time, after you've made some recommendations to them, or you've made a specific diagnosis, and they come back to you and say, you really helped me in this way, or you found this one thing that really helped me, solve this problem. And so that there's really no replacement for that. It's a really special feeling when someone comes and thanks you for something that you did for them. I think another thing that's really nice about medicine is that it's a constant learning process. It's a field where you're in it and you're constantly learning something new every day, and you can never know enough. And you're always learning a new skill. And so it's very rewarding to continue to, meet new challenges and continue forward with those. So I think that's a really great thing about our field.
Yeah, I'll just add on to that. It's wonderful to have the good outcomes. Every now and then there comes a case where, for example, this woman had really large PEs, or pulmonary emboli, or blood clots that had traveled to her lungs, and she couldn't breathe. And there's a way to treat that by either removing the clot with a catheter or breaking out with a certain medication. And every now and then, I did that, and the woman could then breathe comfortably, and she was fine. And it was really rewarding to see that. It turns out she was a family member of one of the people at the hospital, and she started posting on Facebook, thanks to so-and-so and so-and-so's team for doing all this to help me. And it was great to, really feel like I was helping her out. So.
Awesome, thank you for your responses. I believe RT should have the next couple questions.
Yeah, so our next question is from Sai Ramadas, and it's mainly for Dr. Xiao, but anyone else who has a similar experience. And the question is, how do you handle working with kids who may not know exactly what's happening around them?
Well, the variety of situations, like you do age appropriate relationships with the kids. So if you have a 2-year-old, you're not going to do the same thing as you do a 4-year-old. If a person's sick or is under, let's say he has some kind of surgery, there's a whole preparatory process by which we talk to the parents how to prepare the kids, what's going to happen. We're very clear of explaining to them the entire procedures so that they're not afraid. We allow the parents to stay in the room. In the past, parents, there weren't beds for parents to sleep in the hospitals, but now there are actually beds where parents or siblings can also stay in rooms with the children. We make it possible to make it this fear of what's going to happen and the procedure itself as painless as possible by having people with them and explaining as much as they can that's appropriate for their age. I think that is one of the most difficult things during this COVID crisis. You'll hear over and over again that people die without having their loved ones near them, unable to touch them or be with them, and that's extremely important for children. Old people and young people are very much the same.
Yeah, that's really beautiful. I really love that. Either of the MacArthurs, do you have a similar experience working with children, or like in your residency or your fellowships?
I don't work with children that much. So I don't have much to share there. I have my own children who have all their own issues, but not at work. That's at home.
Okay. Oh, yeah.
Oh yes, me too. I'm an adult gastroenterologist. I have some adolescents in my practice, but not young folks.
I'll give you another example of so I did circumcisions on babies. Now in the past, all the obstetrician OBs would do the circumcisions on the baby, and they never used anesthesia. Very quick procedure, and the babies would cry, but then it was over, and that's how they did it. And then 10, 20 years ago, people saying, babies do feel pain. There's a pain score. These babies, even though they have tubes in them and stuff, they do. And so we had physiologic as well as observational signs of pain in the children that we used to observe. So I introduced in the hospital giving local anesthesia during circumcisions to the children, and they didn't cry, and we started giving them sugar solutions to suck on during the procedure. So we make it as we learn more and more sensitive to what the patient's needs are, medicine adjusts.
Mm-hmm. Awesome. Thank you all. And I know Tiffany has the next question.
Oh yes, this one's for Dr. Daniel. And our member asks, what are some of the coolest devices you've worked with as a radiologist? And how do you foresee the future balance between doctoring versus using devices / robot surgeries?
There's some really, really interesting technology in interventional radiology. For example, the tumor ablation treatments I do. For example, I just saw a patient with a 3-centimeter kidney tumor, and he lost his other kidneys. He only has one kidney. So if they were going to do a traditional surgery for that, he wouldn't have a kidney left. So the other way to treat that is to put this small probe in right into the tumor, and I can use a CAT scan to guide that probe into the tumor. And the tip of that probe delivers intense heat energy and can necrose the tumor, and you can control the size of that necrosis based on how you deliver the energy. And then you can basically kill the tumor while preserving the rest of the kidney. And so that's a lot of fun. And it's really rewarding to be able to say, okay, that cancer is now gone. And they go home the same day. They don't even have to stay in the hospital. There's no stitches even. It's just a Band-Aid. So it's pretty remarkable technology to be able to do that, to say your kidney tumor's gone with just an outpatient procedure, you might be sore for a couple days, but I mean, that's a really great advancement.
Awesome. Thank you for your answer. RT has the next question, I believe.
Yeah, so this question is for everyone, but especially because you all have different specialties, and it's from Robin Zhao. So what made you all choose your particular specialty?
Well, I chose mine because I liked children and I wanted to work with children. And when I took during your medical school training, you go through each of the specialties and you see what you like, what you don't like. What attracts you. And when I would go into an exam of a elderly gentleman, I had absolutely no desire to do a physical exam on that guy. And I would, young student, and I would sit there and I would say, if you really want your asthma to get better, you really got to stop smoking. And he would say, right. And I knew that I wasn't going to get very far with the older patients. So I chose pediatrics. And then as I said before, I went into neonatology because I liked hospital work. I liked the excitement of the hospital.
Awesome, thank you. And any of the other? Yeah.
Sure. I think I spoke a little bit about this before. I think the hardest part for me was figuring out what to do, where to go from after medical school. And I couldn't choose. I liked everything so much. And that's why internal medicine really fits, because it really encompasses everything. So that was nice. And then once I was there, once I was a resident, I was able to figure out which patients interested me the most. I think the field of gastroenterology, for most specialties within internal medicine, there's very few that have a procedural component where you can actually do procedures on patients. Cardiology and gastroenterology are the main two where you can. And so it's unique in that field. And I really found during residency that I like to do procedures on patients in the ICU when we were putting in, IVs and things like that. I really liked that. So I knew that I wanted to try procedures. And so that's why gastroenterology fit. The other reason that it's a good field is because we have some patients that we see lifelong, but we also have some patients who have very quick problems that can be fixed. So it's a nice mix where you're seeing patients in the office and you're also doing work with your hands. It's a really nice balance.
Yeah, thank you. And finally, Dr. Daniel.
Yeah, so in medical school, you'll spend, a few months in each specialty. You go through surgery, you go through OB, you go through pediatrics, neurology, you'll do everything. And I liked a lot of them, to be honest. I thought radiology was really interesting, and I liked the procedural component of interventional radiology. I just enjoyed that rotation the most, and so that's why I went with it.
Yeah, I really like that. Thank you all for your answers. And I know Tiffany has the next question.
Right, this is coming up a lot, but a lot of people have asked, how do you maintain like a work-life balance? And I'm sure there's no perfect solution, but I guess how did everyone in the panel maintain your social life, your health throughout medical school and then residency and then fellowship, and then now practice?
Sure, I can start. I think that the journey to becoming a physician is a long one, but it's, in the end, I've realized it's so worth it. I love my job. I think that work-life balance, however, is probably the biggest challenge that I face, especially being a working mother. I think that probably the hardest time for me was during my residency when I had our first child as a third-year resident and having a very small amount of time with her off and kind of having to negotiate with program directors to figure out how I wouldn't have to extend my fellowship and how I wouldn't have to extend my residency and could go straight to fellowship without having to take time off, and how I had to return right back to the ICU after 6 weeks and work 30-hour shifts and kind of make it through. So I think that that was a very difficult time, but it made me stronger and I made it through. And I still was there when, our kids had very big moments. And now as an attending physician, I've learned that the best way for me to balance time is I have one day off a week where I can be with my kids that day and kind of help them with whatever they need to and kind of be present for them in their schooling or in their activities. And so that's a really nice way that I can maintain balance. But I do think it is hard in that, making sure to make time for both things. Especially now as a parent, but even, during residency and medical school, making time for social interactions and being part of clubs and playing sports where, being on a team was a big thing for me. And so trying to find those times is really important to balance. But I do think it's a challenge, but it's also very important going forward to avoid burnout, which is a real thing for physicians because and so it's important to pay attention to and to try to work to find that work-life balance.
It was a long time ago, and you forget how it was. I can't, having 3 children, I decided not to have kids during my residency. And there was one physician that decided to have 2 kids during her residency, which really upset us because we had to cover for her. During my residency, I had to work every 3 nights the first year, every 4 nights the second year, and every 5 nights the 5th year. And when that resident decided to have 2 babies, and she had cesarean section, so she was out for 6 weeks, we really had to do double time, and we were all very angry at her. I'll just tell you that. But anyway, if you have a life partner, it's really important to have one that understands, supports you, and has the same values that you do towards the family, towards the relationship, towards the kids, and that's what makes it work. That is really what makes it work, because it's if one person's doing it all alone or doesn't have the support of the other person, I think it would be extremely difficult. And I clearly couldn't have done it without my husband. The 2 of us are a team.
Yeah, so definitely a lot of work. It's about, for me, it was 10 years after college, the 4 years of medical school and 6 years of training after that. The key is it's kind of like every year gets a little bit better. The first 2 years of medical school are almost an extension of college, except a little bit more work. It's mostly classroom work. The 3rd and 4th years of medical school are mostly in the hospital where you're doing rotations and seeing patients. And then every year after that, it gets a little bit easier. I mean, it's still a lot of work. So my first year as a resident, or the first year after medical school, we were doing 80-hour weeks intermittently. I think they got rid of that rule. They're not allowed to do that anymore.
Right.
Like capped at 60 or 70 now. So you guys might get it easy if you do that. But then every year it gets a little bit better. Like, your second year of training, a little bit better. And the 3rd year of training, a little bit better. 1 more week of vacation here, a little more weekends off. And then by the time you're done, I don't even know how I could go back and do 80-hour weeks. Like, it just would be impossible. So I think that, it's a lot of work, but it does sort of have this kind of light at the end of the tunnel feel.
Awesome. Thank you to all 3 of our panelists. And I know we're a little bit over time, but if our panelists, do you guys have an extra 5 minutes for one last question?
Yeah, of course.
Sure, go ahead.
Okay, awesome. I guess our last question here would be, what is the best piece of advice you've received during your career?
I would say 2 things. One is learn to be a good listener. That's really important. And that doesn't mean hearing. That means really listening to what your patient is saying. And the second thing I would say is the word armamentarium. And your armamentarium are the things you pick up from different people in your life that you incorporate your training that you incorporate into your practice, because you will meet role models and physicians and a whole slew of different people involved in the healthcare field. And you'll see things that you like and don't like, and that you can incorporate into yourself. Find your own armamentarium, and then you will become your physician.
I think the best piece of advice that someone gave me was, never stop learning. Always, go back and research something and try to learn it better and try to do it better the next time. And when you have the opportunity to learn a new skill, jump at that and take it and really keep growing. I think that's the best thing that I've learned. And I think I've become a better physician because I'm constantly looking and learning and trying to figure out what else I can do to become better.
So those were both excellent piece of advice. I mean, my suggestion would be, if you're thinking or considering medical school, is try to get some experience of seeing what it's like to be in a hospital or work in a clinic. Maybe do some shadowing, or get some real feel for it, because it's sort of like, once you start, it is a long track that you're getting yourself into. So I would suggest, at least getting a sense of what it's like before starting.
Awesome. Well, this concludes our healthcare panel. If everyone could give a good round of applause to Dr. Xiao, Dr. Kristin, and Dr. Daniel. Thank you guys so much I know it's the East Coast over there, for coming to speak to us in the evening, and we really appreciate all your insights.
Okay, thank you for having me.
Thank
Yeah,
you.
thanks so much for having us.